Good morning, everybody. I'm Ruth Ann Norton. I'm the chair of the Lead Poisoning Prevention Commission. We are glad to open here this morning. I'm joined by Paula Veltri. Did you change your name to Veltri?
Mhm.
Yeah, Paula Veltri, formerly known as Paula Montgomery, from the Maryland Department of the Environment. We are in person. Love to see you next month in person. It's spring. It's time to say hello to folks if you can. Wendy, if we could just go through commissioners on the line to make sure that we have quorum. Not that there's going to be any big actions today. This is going to be, as I said, a short meeting.
We currently don't have it, but I'm just going to go through just to make sure. Oh, Mangela just fine. Okay, here we go. Adam Skolnick is on.
Okay.
Paul Rogers is not coming. He sent me a message.
Okay.
Paula Montgomery, Ruth Ann Norton, and Mangela. I just see that you're on. Is there anybody else as a commissioner that's on that I did? Oh, Cliff Mitchell just joined.
Good morning.
Is there anybody?
Barbara Moore.
Oh, Barbara, you did make it.
I did
Okay.
make it. I'm not sure if I can stay
Barbara.
on the whole time though, but I'll try.
Okay.
Anybody
All
else?
right. We're going to have to work together to make sure we have a full quorum next month.
We're too
And
shy.
is Jacob on?
Mm,
Susan?
No.
Anita Cooper is here.
Oh, Benita's here. Okay, you
Yep.
just
And Mangela, I think I saw, did I not?
Yes.
7. We have 7 people.
Okay, and we're expecting Theodore, that'll be 8. And anybody from from Baltimore City?
Julie is on.
Yeah. And Theodore's here.
No problem.
Theodore's here, so we're,
When I expected.
all right, well,
Okay,
we're
that's
gonna,
it. That's it. Yeah, we got it.
but I think we have enough now to just to get adoption of the minutes or no?
Yes, we do.
Okay, so just taking a look at the minutes to make sure that we, any comments or questions on that? All right, adoption of the minutes. Does anyone want to make a motion, please?
Move to accept the minutes.
Okay, a second?
Second.
Second from Theodore. All in favor?
Who was the second? I didn't get the second.
Theo,
Oh, Theo. Okay.
all in favor?
Aye.
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 Somebody,
I do want to make one comment here. I am going to need the department's help, but I did talk to Senator Ferguson this past weekend. He promised that he would quickly move to put a new person on the commission. He has some interest in this. I have invited him actually to come to our meeting in June, and hopefully he will take us up on that with a new appointment for this to do that. And we need to still reach out to the Maryland House to get an appointment underway there. A couple of things. There was a
Barbara has her hand up, and there is somebody who is on the phone. I think, is that you, Anna? I want to make sure I mark you if it's you.
Hi, yes, it's Anna.
Okay, thank you.
Thank you, Anna. Barbara?
I've
I don't know
spoken to 2 parents. One is really busy with trying to relocate right now, and both of them said they'll consider. So I'll keep you informed as we get
Yeah,
more
and
parent interest.
you're keeping Angela informed of that too, I hope. So we'll
Great,
work
as soon as I
with
get
you,
an answer.
right, on that, and we'll work together. But I'd like to get that into Secretary Edwards as soon as possible. We have reached out to Secretary Edwards' office. Wendy, did they reach back out to you about pending appointments or anything?
So the last thing I hear is that they have all the stuff that they need. It's just they haven't gotten to it, and they don't know when they will, but they will.
Okay, I will follow up there. And I know that Cliff, and we get it into discussion if we know any more from FDE or FDA. But it is thrust upon us pretty quickly by the federal government. It is National Healthy Homes Month. If you are not aware, your agency is not aware, it is National Healthy Homes Month. There is a series of actually pretty good webinars and learnings that are going to be coming out of the U.S. Department of Housing and Urban Development. If your agency wants assistance with a social media toolkit or anything to help just promote the concept here, especially I would say, you know, Maryland is moving more and more to a whole house approach. The Governor's Enough Act has a pretty strong focus on lead and it's going to be grounded in a lot of work around lead. I would encourage DHCD, MDE, and others if we want to do that. GHHI is planning on doing a webinar around all of the federal opportunities available for Maryland entities throughout the state through both today's announcement of the $20 billion that was given on the greenhouse gas emissions, and $8.97 billion of that is going to Maryland-based organizations. $6.97 billion is going to what is called Climate United, which is actually the Calvert Foundation, who are based in Montgomery County. Just matter of disclosure, I am on their advisory board for this. And the Enterprise Foundation, who's getting $2 billion, of which they're going to devote 75% of that to housing upgrades in our lowest income communities, and certainly hope that Maryland will be able to benefit from this. And so we're going to have a webinar that's going to talk about the Thriving Communities Grant Program that is launching, and the $7 to $10 million that'll be available for Maryland organizations to build capacity around environmental justice, environmental health, and certainly around lead. There'll be an opportunity for us to strengthen organizations around the state to build partnerships there. It is also available for entities that come from childcare and environmental advocacy. Also will address issues around water, around soil, around air emissions. So much good opportunity, but we will be putting that announcement out in the next couple of days around this webinar and training. And then the other thing that we'll be doing at GHHI is a toolkit for organizations on how to capture these climate funds for things like lead and healthy housing. And I also will just let folks know at GHHI, we are very excited we'll be promoting Wes Stewart to a new position within the organization. He'll still have a lot to do with Maryland programs, and Cliff, don't worry, he's still going to be connected to you a lot.
You read my mind.
Yeah, there you go. But we have hired Jonette Richardson to be the new Senior Vice President of Maryland Programs. She is the Chief Operating Officer for Neighborhood Housing Services, former chair of the Baltimore City School Board, extraordinarily good person. It also allows us to have Wes spend a lot of time on things that are critically important to the organization as it has grown. That will transpire in June. On June the 3rd, we will welcome Jonette, and we've also hired a new chief of staff at GHHI, Candace Dotson-Reed, who is the former chief of staff for Freeman Habrowski out of the University of Maryland, Baltimore County. And she is joining us as chief of staff on April 16th. and is currently the legislative and government affairs director for UMBC. So may know many of you well. Anyhow, I thought I would make sure that you knew that as you started to see new faces in the mix in that. To that end, Adam and Wes and Anna, legislative updates. Wes, do you want to start on any legislative updates for the commission?
Just a couple of notes. One is the bond bill has passed the Senate with 4 million for the special loans program. We were going to ask DHCD just to indicate if that's an increase, is that stable funding or not, but it did pass the Senate with 4.0 million.
Okay, hang on 1 second, Theo.
I believe it is stable funding. Jack, can you confirm that?
I don't think that's on.
Oh, okay, Jack, you're on. I'm a good 90% sure it's stable funding. Yeah.
Okay. All right. So some money there for things like lead.
Yeah, everything's a first come, first served basis. So whatever the needs are, that will.
Responsive lending.
Sure.
Right, that's what we're calling responsive TA and thriving communities, right? What's the need? That's what we're going to respond to. Go ahead, Wes.
Sure. House Bill 245 was the MDE fees increase for registration fees that passed. The House has not received a voting committee yet from the Senate side.
What is it in EEE?
Yes.
Any word from MDE on help or need there? Paula, do you know?
I don't know, like specifically on that bill. I mean, it was a bill we introduced because we haven't, increased fees since 2012, and it seemed to be moving forward. So,
Adam, do you know anything about this, or are the owners opposing, or can you update me?
I'm sorry. Tell me what the point. I just got back. I apologize. What was the point?
I'm going to come back to you. Stephanie, you have how are you, Stephanie? Good to see you.
Good to see you too. I was just going to say, last Tuesday, there was a Senate hearing on the department's fee bill, and there was testimony in opposition to the increase in the registration fee. The gentleman's name is not, it's escaping me right now, but he does represent like the rental, like the owner community.
Okay.
Grayson Wiggins.
That may have been his name. Yes.
Yeah. He represents me.
Yeah, Adam, is it a strict opposition, or is there room to negotiate that for the state?
No, there's room to negotiate 100%. And we told MDE that, and they didn't want to negotiate. So we said, okay. And quite honestly, our opinion right now, that bill, compared to the other things that the governor and the legislature are coming after our industry on, including, limiting access to the courts by making court fees non-recoverable. So we, the fight was picked with us, not us picking a fight with the governor. And we've just decided that we didn't see a lot of room on a lot of these things to negotiate because the governor wasn't willing to negotiate. And to be fair, I don't know if it's the governor or his team, but it's all the same difference. So we are more than willing to chat. But, the frustration has been that it feels like in the governor's shop, one hand doesn't know what the other's doing. So they don't think they're attacking the multifamily and the rental housing industry, but they are on all different sides. And one hand doesn't know that this fee is increasing or that fee becomes non-recoverable. And then we explain to them in a holistic approach. They're like, oh, we didn't know that. So it's been an incredibly frustrating session, to say the least, for our industry.
Well, thank you, and thank you, Stephanie. But it's pending vote is basically the status. Is that right? In the EEE committee, is that right? In front of Brian Feldman's committee?
Yes.
Yep.
Okay, great. Okay, Wes, anything else impacting directly or indirectly lead?
Sure. The baby food, lead and toxic metals labeling and testing that passed the House and yesterday passed the Senate committee. So that looks like it's going to go. That's
okay.
Mandatory labeling and testing of baby food.
Cliff, anything you want to say about that?
It
It sounds like a good thing, right?
Sorry?
Sounds like a good thing.
Yeah, we've been following that bill. It's a little complicated because California is the only other state that has a legislation like this. And we always, as a general rule, we try to work with the FDA on, because it has national implications, to change labeling for a particular industry in one state. But that being said, there's certainly an interest in trying to improve the ability of consumers to understand what it is that they're buying in the baby food category. So we have not, the department's submitted a couple of letters of information on this, but we are not the ones driving it.
Okay. Okay. Understand. Wes or Adam, I don't know if you had something to say. It looked like your face, your bubble lit up there.
Nope, good.
Great. Anything else? Barbara has her hand up.
I apologize because I hadn't been following the bill. Would this pick up the issue that is the testing having to be done here in Maryland? So if it's something that the product is started in one country, processed in another country, cinnamon crushed in another country, and then finally all gets packaged as being sold here? Or is it only what's manufactured here? And from starting.
So yeah, it's a very good question, Barbara. So this would affect processors, distributors, and pretty much everybody in the chain, but it really goes back to the processors and manufacturers. The onus is going to be on them. But it also allows, at least in the one of the versions that I saw, it also allows a consumer who's concerned about the values that are on the label to submit complaints to the department, which means the department would be required to follow up. And that becomes a little bit complicated, because if it's not a manufacturer in our state, it becomes a sort of a, we have to involve other states and the FDA. Suffice it to say, it'll be an interesting, if it passes in its current form, it'll be interesting to see how it gets enforced.
It sounds difficult. All of this is difficult to enforce. I mean, across the board, right? It's,
Yeah.
We've found that in the lead and jewelry. We found that in all sorts of different ways that things come into the country and otherwise. But
Yeah, ideally, you always want to have the person who is putting the material into the bottle at the point before it goes out to the consumer to be the person who is ultimately taking responsibility for ensuring that it's a safe product. And that's the premise on which a lot of this is based.
okay. Any other comments on this? All right, thank you. Anything else, Wes?
Yes, Senate Bill 983 was the phasing out of lead and ammunition for hunting. That received a Senate hearing. The House Bill 1473 never made it out of rules since February, so that doesn't look like that legislation is going to go anywhere this year. But that was to eliminate lead and ammunition for hunting. So, and then the last one, which Adam mentioned, was the governor and DHCD's Renters' Rights and Stabilization Act. That would substantially increase the court fees. The reason that's important for the commission is it would also provide additional funding for the relocation assistance funds that DHCD has to give around the state. So I know that's been a big area of focus for outside of Baltimore City. But that bill has passed the House, but has not gotten a vote in committee of JPR and EEE in the Senate. But there was provisions in there to use some of that additional funding to pay for increased relocation assistance funding.
Do you have any like to say on that?
Yeah, are you referring to the state voucher program?
Yes, and
Yeah.
and also the relocation assistance fund, which had been dramatically increased during COVID, has now gone back to its prior normal state, and there's just not much funding for that. So.
Yeah, okay. Yeah, I have nothing else to add on that. I mean, negotiations are still going on, so.
Okay. Adam, do you have anything to say on that?
No, I do not.
Okay. All right. And Anna too, I'm sorry. there's anything you'd like to add. Wes, you confused me by having George up there, but, on your screen, but, so George, anything else?
I did not know if Anna had anything.
Anyone else on legislation? All right, it's been, one of the weirdest, legislative years, I think, ever. Not sure exactly why that is, but it's been an odd one. For those who, it does have a tangential impact. The Empower Reform Act did pass. The Senate is now on its way back to the House. There's one bit of difference because the Senate bill exempts a small power company on the Eastern Shore. The House bill does not, so they have to figure that out. But it will impact the dollars getting into housing for energy efficiency, which has to be coupled with health and safety, of course, dollars. And the significant thing it does, not lead related, is changes how we earmark or how we mark progress by greenhouse gas emission reductions versus kilowatt reductions, kind of foreshadowing the future. It was a big bill supported by the Public Service Commission and the Office of People's Counsel, which is not usual. So we're happy that that has moved forward for sure. Okay, we want to move on to hot topics or not hot topics, whatever they may be. I know I will give one update. I don't know if Susan Kleinhammer is on, but MHIC said they would happily come to the commission meeting, but only after session. I think that's correct, right, Wes?
They asked to meet after the session, just they were occupied before then, yeah.
Okay, so on the tying MDE's certification work and the MHIC licensure, they will come and have a discussion with the commission at the next meeting. So we will pursue to make sure, because they've eluded us for, I don't know, 3 years or so, right?
10 years,
10
probably.
years, yeah. Well, we're gonna nail them down to get them into the conversation. But Paula or Fred, anything?
I don't have anything. Fred, you have anything?
Yeah, I have a few things. We're been working with Dr. Mitchell on some adult-led things,
Oh, I think that's great.
and we are looking towards, as far as the Key Bridge is concerned, we have been getting a lot of questions. Primarily, lead is not really involved in it, but we are. I think Dr. Mitchell is working on meeting with Moshe. So Moshe is going to be tied to this as far as worker safety. So we'll be looking for clusters as adult-led results come in to see if there's any trends or anything like that.
Yeah, so can I,
Yep.
hey, Cliff, you know, this was an issue in the Bay Bridge restoration.
Yep.
Right. Had a lot of issue around lead in the Bay Bridge restoration. I assume it would be the demolition procedures here on the current structure, which would pose the
Correct.
risk, right? And
Yes.
I guess the very first thing is just making sure that someone is there, ensuring that safe practices. I mean, the last thing we need to do for the bridge workers is add insult to injury here. So is MDE actively doing that?
So it's going to be Motion, Department of Labor.
Yeah, it'll be, actually, it's two organizations at least. So on the water, it's the U.S. Occupational Safety and Health Administration. Because it's on the water, that jurisdiction is actually federal. On the land, it's Maryland Occupational Safety and Health.
Got it. So when it comes on land, how they, I guess, dispose of the materials, right?
Right. Well, and disposal is governed by Moshe by MDE under its waste requirements.
The one thing obviously is making sure there's training, that there is some sort of training happening. And then the other is, will we monitor the workers by blood lead, right?
Right.
So these workers would all either fall or not fall under the lead in construction standard. And that is administered, that's federally under OSHA, here in the state under, and it's basically the same standard. So I will say there are more organizations, entities, and parties involved in this than you can shake a stick at. And it is a huge undertaking. So as with any construction project, at some point or other, I'm confident, and I will check because I'm interested, but if there's monitoring going on, that would determine whether or not and what kind of PPE is involved. This is obviously a hugely complicated and dangerous operation. So, and then the underwater stuff is sort of taking care of itself because they're all wearing SCBA, so that's not an issue underwater.
Well, if it's, I mean, yeah, the water table, how significant that would be, I don't know, but all I want to make sure for sure is, given the worker population working, that everything is in translation.
Yep, and we talked about that at the MOSH advisory board meeting yesterday.
And just also giving the education to the workers that when they leave the work site, right, what they take home, making sure they're getting out of the clothing before they go home.
Yep.
Right? Simple stuff, but sometimes we overlook it, so say it.
Yep.
And just making sure that that is, part of the issue. Do we know, are they, they're choosing one of the two shores, right, to be mainly their ingress and egress? Is it the Dundalk side? Is it
They mentioned the staging area. I missed it when they said where they're going to stage the things. And I know I met with our recycling and solid waste guys last week to see if they're on it. So they're on it, so I can find out and email it out.
Yeah, I know that safety is obviously primary. And Stephanie, yes, ma'am.
Yeah.
So right now, I believe that there is the thought of using a part of Trade Point Atlantic's property to stage materials once they are removed from barges. I was at the command center yesterday, and there was discussion from one of the contractors that they are hoping to start removing steel soon and barging it. So, and then once, barges are full, they'll start offloading. So LMA, my administration, is working with MDTA and the Port Authority, and we're having discussions about that and about the activities that will have to take place once wreckage is on shore.
Well, for everybody who's working on this, thank you. Added, we have to deal with tragedies. It always adds a bunch of stress in the system. So thank you to our public servants here who are working on it. And, if anything that we can do to be supportive, but just getting that language translation and making sure at least people see the messaging going in and out of the workspace. I'm sure the rest of it, they're following good practices there. All right, anything else, Clifford?
So a couple of things, just a shout out. So first of all, I want to introduce somebody.
Hang on a minute, Cliff, I apologize. Did I shortchange MDE? Sorry, you had other things.
I did have a couple other things.
Yeah, Cliff, I apologize.
Well, okay, sure.
We just finished
Apologies for my brain who hasn't had enough coffee this morning, Fred.
We had a partnership with MICA, Maryland Institute College of Art. Their graphic arts and design students were going to work on a calendar for kids when the inspectors go out to kind of keep the kids
Oh my
busy.
God, that's great. That's great.
So they just finished it yesterday. I'll email out the draft today, but they did a whole calendar. Each month has a topic related to lead safety. And then there's they did GIFs for us too to go up on our social media page to kind of echo lead safety as well. So we're very happy with the
Well,
product.
please share that so that we can all help amplify that.
Yeah.
That's
yeah,
great.
yeah.
It makes the process friendlier too.
Yes, yep, yep. And I think that's it. That's it for me.
You sure?
I'll stop there while I'm ahead.
Want
Yeah.
one more?
No, I'm good.
Okay.
Yeah, yeah.
All right, Paula, you good?
Good, thank you.
All right. Thank you. Dr. Mitchell, you're up.
Well, I have a bunch of kudos and congratulations and recognitions for people. One is I want to introduce somebody who has worked in lead without without any fanfare since about 2008 or 9. Dr. Nancy Servatus, who's on the phone or on the, some of you may know Nancy. Nancy has worked in the Department of Health, and she is the person who coordinates between the public, local health departments, and the rest and state agencies. And she has done that work sort of unbelievably for many, many years, with inadequate recognition by me of the indispensable part she plays in helping physicians, patients, people affected by lead. So I just wanted to introduce Nancy for those of you who don't know her.
Is she coming online so we can see her and say thank you?
Well, not online, but I am here.
Nancy, thank you so
I
very
want you to
much.
know that the helpline is getting really busy with lead inquiries, yeah, especially the last few months.
So tell us a little more about that.
unnoticed.
Can you tell us a little more?
Nancy, you may be on mute, but
Like,
Ruth
what are
Ann
we
was wondering if you could just talk a little bit about the kinds of calls that you've been getting.
Sorry, Cliff, I took off my microphone, my earphones, and I didn't hear the question.
Yeah, no, could you talk a little bit about the kinds of phone calls that you've been getting more recently on the helpline related to lead?
Yeah, I think the most recent and the busiest are MDs that don't know how to move ahead with the program, what to do with the kids that have lead levels. So those conversations take a while to explain it to them. But yeah, and then of course moms. I get a lot of moms and a few dads that are concerned that their child cannot be helped. So yeah.
Well, Nancy, if GHHI can do anything about going to the home and making sure that what is currently existing in the home is safe, or there's understanding of what parents can do on that home visiting level, or any support that we can give, please do let us know, including gathering parents for any kind of trainings, meetings, and as maybe Barbara would agree or not, but I think sometimes it's also important to give parents the opportunity to meet each other in this. It builds a lot of help in the system of them being able to become ambassadors, advocates for others as well as themselves. So if we can utilize this tool to help advance awareness and over time prevention, please call on us to do that, please.
Oh, yes.
Oh, I'd love to. It sounds great.
Yeah, and Ruth Ann, we will continue to do that in coordination with our local health departments and
Yeah,
you.
of course.
Yeah.
I think it wouldn't be a bad idea if we see that what we're seeing to pull everybody together. I'm sure
Yep.
you're thinking about this.
Yep.
Talk about it. Whether it's a webinar or something. And again, if GHHI can come in and host it, we're happy to do that or help you or support it in any way. But
No, I appreciate that.
okay.
And so let me just say, I did not warn Nancy that I was going to out her. So I apologize to you, Nancy, for outing you without warning. But I did want to make sure that we recognize all the important people who are working behind the scenes on this. In that same vein, I just want to tell you a little bit without violating medical confidentiality. So this story will be intentionally vague. in the details. But I do want to express my gratitude to Barbara Moore and the Mount Washington Pediatric Hospital and a Western, a county in, not in the middle of Maryland, that had a very complicated case. And this was a multi-agency response that took a whole lot of effort. But I just want to say that it demonstrates, and again, with thanks to Barbara and GHHI and the Department of the Environment, Department of Health, local health departments, and others, we were able to effect a kid who was seriously lead exposed. And Nancy alluded to this as well. We are continuing to see more and higher lead levels in the last couple of months, probably a result of COVID, deferred care, kids spending more time in their homes. And so the work continues, and I just wanted to acknowledge all the many agency partners who have been collaborating to try to address this issue. So that's number two. And then number three, and Fred, I thought it would be helpful just to mention that MDE continues to make progress in its Healthy Homes and Lead Poisoning Surveillance System. And one of the things that Fred and I have been talking about is pulling a group of stakeholders together from local health departments to figure out, as we move forward in the next 5 or so years, how we are going to sort of wrestle the enterprise that is information technology and information sharing to most effectively do that, given the limited resources that are available in many health departments, to make sure we're not overburdening them, but still giving them access to the information as much as possible. So those are the things that I think are probably highest on the agenda.
Yep. Any comment?
Yeah, so we actually met with Colleen Hess from Dorchester yesterday. So we've been inviting local health departments to join in helps, and then we've been training them on how to use it. So right now we got 3 counties in, and we're still sort of crawling our way through helps. I reached out to DC Department of Health a couple weeks ago, and they've been really helpful. We're going to make a site visit to them. They have some successful helps. They're on a later version than we are, and hopefully when
Maybe ahead or behind?
ahead of ours. So we're on 6.5, they're on 6.6. CDC is actually on 6.7.1. So we want to try to get as much ironed out before we actually migrate to 6.7.1. So our tour starts with DC, hopefully in the next week or so, and then Delaware, who's actually moving out of helps. They were really dissatisfied with it. So
yeah,
try to get a full picture of where it goes. But I think the most important thing that Dr. Mitchell said was the county seemed to be on board with this. It's a way for us to speak the same language, have all our information in the same place, be more efficient, be more expedient the way we respond, and be able to correct information. We just had a recent case where a lab sent us an elevated blood level of 200. Everybody freaked out. Thanks to Dr. Boss and Dr. Mitchell for letting me know that that's virtually impossible. But for somebody that doesn't have a medical background, I'm running around knocking
So what
people down.
what did the retest show?
It was a bad lab. So, but everybody, to speak to what Dr. Mitchell said, everybody kind of jumped in. We got the kid admitted at Johns Hopkins, retested, got the test results back a little later than I would like. It took 48 hours, but we were expecting something immediately, but we realized that the level was below 1, and the kid went home happy. So, and parents were happy as well. So, but one of those things, we're always on the phone.
Wow, what an amazing amount of resource redirection because of a bad lab too.
Yeah,
right?
Yep.
But Cliff, I want to say, like, this is the maybe 4th or 5th meeting in a row that this statement has been made. And I'm trying to figure out, how do we address this? How do we get ahead of it? What do we need to do? Which is that we are seeing more and more higher levels of lead, right? And
So to be, yeah,
gotta
go ahead.
whatever root cause is on that, right?
Yeah.
Because that's my head goes to, okay, what's that root cause of that handful or group of higher level leads that we're seeing? Because that is damaging. And what is the role for all of us at this table to help address that? What do we need to know, learn, and what actions can we be taking that are getting ahead of the curve rather than documenting this on the back end where we're less helpful?
So I guess I would say,
You understand my question, right?
yeah, no, and I do understand your question. So I guess I would say two things. The first is, again, what we are seeing are isolated, as you said, cases of higher lead levels than we have typically been seeing over the last several, well, probably 5 or 10 years in a relative cluster. But I think that there are a couple of things we don't know yet. One is we don't know whether this is truly an increase in the number of kids with elevated blood lead levels, because we don't have we're still waiting for Shamola and the epidemiologists to tell us what this looks like for the state as a whole. Second thing is, it's very clear, we don't know what the source of lead is in all of these cases. Clearly lead paint is playing a big role, but in this most recent case, for example, we don't actually know where the exposure took place. And it's quite possible it did not, it's possible that it took place not here in Maryland. So we don't know the answers to those questions yet. So I think, to Nancy's point, one is we need more engagement with providers so that they're alert to this and are doing testing. Two, I think we need to understand the epidemiology and actually see the data and look at the data and come back to the commission with an analysis which shows if this is a trend, where is it taking place, or where are the places where it's taking place, and what are the root causes, as you say.
Well, we need to hone in on that. Yeah, Barbara.
One, let me know if Mount Washington can do anything to help with the education for the providers. But I think also we need to assure that the providers in the area know what the guidelines are for testing any children that are refugees or immigrating from another country. Just in general, because that would definitely help us to know what their level was when they first came to the U.S.
Dr. Mitchell, question. Are we seeing this uptick nationally, or is this somehow unique to Maryland?
We don't know the answer to that question yet.
Mm-hmm. Thank you.
Yep. So it's a very good question.
What was your question again?
Oh, just if we're seeing this nationally, or if this is something.
Well, I can tell you we are.
Okay.
Let me weigh in on that, right? In the states that we're working in, we are seeing that in many places. I think when this initially was coming up, people were kind of equating it to sort of a post-COVID, like because of people weren't getting tested and things were happening, right? But the age of the kids don't necessarily track with that. But Cliff, I'm sure you've had this, but the CDC folks have raised this. I think they ought to be talking about it. They ought to be looking at the same thing, like what's the trend here? Are we better at testing all of a sudden? And what is it that's making this show light? Now, I asked the DC folks about this, and they did not have that. But what concerned me about DC as you start to engage with them, right? It's that most of their lead surveillance is because of water. And what I tried to explain to the folks in DC is just the evidence is clear. There's very few kids who you can point to in the United States whose primary poisoning rates are water. The exception of Flint was that was being force-fed to people, right, because of the chemistry changes. And you know, my encouragement to the district is that it get back on the horse on the housing side. And really look at that because it's not only important for them, it's important for the kids to go back and forth across the border here that we need to be looking at. I'm also really interested to have Maryland have a better partnership relationship role, or at least known, it may already exist, with Pennsylvania. Because what we do know, you know, in the borders around Pennsylvania, especially central Pennsylvania, there's a lot of need. Now, we're doing, you know, a dramatic amount of work in Lancaster County that has now about $70 million or more dedicated to this issue. And that's hospital-led with our, there are partners in this, right? And it's hospital-led. So we're going to see like a bright spot there, but the other parts of Pennsylvania, I think could learn from, and there could be a good regional response. But I think they could really learn from MDE. That's
One of the
not that you have extra time, but you know.
One of the recent cases we had was a child that had dad on one side of the state in Pennsylvania and mom on the other. We realized, well, when we talk to Pennsylvania at least once a week about cases that transfer back and forth, how they inspect the homes, how they gather information is very different than what we do. So we're trying to communicate with them, not just with tracking kids that transfer back and forth, but also exchanging information so we get the answers that sometimes we miss because they don't do the things that we do. They've also helped us out with some testing, some analysis. We just, myself and our chief of accreditation just sent some evidence paint samples to their forensic department to test for us. They got a really good testing center. So we're trying to develop these sort of interstate partnerships because, you know, as you guys know, lead doesn't really abide by geographical lines. So we got to kind of work with the people around us to, you know, as people move back and forth. So.
Well, we've got people in York, right, that they live in Maryland and they're getting their healthcare in York, and they live in York and they come get their healthcare in northern Baltimore County. And so appreciate that. Dr. Mitchell, anything else from the MDA?
Nope. Thank you.
All righty. We will next go to, Paul's not here, but I work to connect Dr. Mitchell, you and Dr. Rogers with the DC teams. Childcare, Mangela, anything that you have?
Just to piggyback, good morning, just to piggyback Mr. Banks' statement, childcare also is working with the other state healthcare providers of the children who are attending childcare in Maryland, but not being tested for lead. So we inform the childcare providers who have children from other states, like parents are working in Maryland and they bring the children to Maryland childcare locations. And the childcare staff notice that those children are not being tested for lead. So we are providing education and also requesting for lead testing for these children, since the Office of Child Care is invested in yearly education, yearly learning, and age-appropriate development and growth. So we are also working with the interstate healthcare providers to have these children tested.
Mangela, I want to just encourage too, as we start to roll out thriving communities, if there are advocacy groups or groups working on things like lead or other environment exposures for kids in childcare, they would be eligible to apply. And I'll talk to you more about that, but we want to make sure that we get information out to build strength in these things, right? Including making sure kids get tested and they get education and they get the things they need. So really appreciate you. All right, young man.
Yeah, we got a few updates. One, unfortunately, we were not successful in the Healthy Homes Production Grant. We are waiting on HUD for a debrief on that to figure out, what was not successful on that. And we are, looking out for the next round coming up shortly. In some better news, we're currently in the process of developing a revised or a new handout that more accurately describes what the program will and will not cover. For example, it will cover,
Which program?
oh, sorry, the lead remediation program. My apologies. In terms of, it will cover any critical repairs to the home that, may lead to the lead remediation not being successful down the road, but it won't cover, general remodel.
Can you pause for 1 second? Hey, Wes Stewart, are you still on the line?
Yes.
Do you, and you may know, but do you know when HUD is coming out with its next round of lead grants?
Do not. It wasn't posted as of last Friday, but we
Should
we're
be
monitoring.
imminent though, I
Yeah.
think, right?
Yep.
My understanding, yeah, yes.
Yep.
Okay, so
Grants are
there's the National HUD Program Managers Meeting is next week in Minneapolis. They may announce it there.
Makes sense.
I want to encourage on the record for the state to work with GHHI. We manage 7 right now HUD-led grants and an MDE and MDH and the partners to make sure that we put in a really robust application.
Yes.
We're all here to help. No reason the state shouldn't get this. I know that this occurred before you came into the role, so we'll start with a fresh page and try to do that. But I think we're all behind you to get both of those grants and maybe a third for the older adults.
That it was
Well.
still is undergoing older adult. It's not for lead remediation, but
You have one in for older
Yeah,
adults as well.
yep,
Okay,
that's
good.
for
Our fingers crossed.
like similar to critical repairs, sort of.
Paul and I are getting up there. We might need it soon, so.
I know.
It's okay. And these things happen. You learn a lot from the debriefs, and I know you're trying to do the right things there. So just want you to know that we're all here to team up and help the state get the money.
No, I'll make sure that message is heard loud and clear. So, thank you.
Especially, yeah, if there's anything we can do to help with data and,
Writing it if we have to.
yeah, right.
Okay. Anyhow, let's keep moving.
I'll make sure that message is heard by those that need to hear it. So, thank you. So, in addition to the actual, handout, we're also looking at the program more holistically. As you mentioned, we are all moving towards this whole home approach. So trying to look at how the program, may lack some efficiencies and where, the program can, gain efficiencies. Additionally, we are seeing an uptick in applications, particularly outside of Baltimore City, which, is in line with what everyone else is saying, and processing those applications accordingly. So those are the updates that I have from DHCD or MD DHCD.
Great. Fantastic. All right. Wendy, who's up next here? And everybody send Wendy some good thoughts to feel better. The
Health department.
I don't think we heard from Benita Cooper, did we?
We have not. Benita, anything?
No, nothing new.
Okay, sorry, Benita, thank you.
And then Nicole Hart and Catherine Taylor.
I don't think either are on, are they? But
Yeah, they are.
Oh, okay. Sorry about that, Nicole and Catherine.
You're muted.
We can't see them. I don't know how we can possibly see.
Yeah, they're both muted.
There's
Nicole?
Nicole, we can hear you, friend.
I'm not sure if you can hear me, but I don't have any updates. I'm not sure if Pat has any updates.
Okay, and Nicole, I hope we'll see somebody from Baltimore next week in Minneapolis. We can catch up.
I hope that's the case, and it'll be about, I think, between 6 to 8 of us.
What did she say?
I think she said yes.
Okay, see you there. Best pizza in the country is that young Joni in Minneapolis for anybody to know. Julie, I think you're on the line.
Good morning.
Hi,
How are you?
how are you? Welcome. Anything from the health department side?
No big updates here. We've been doing a lot of testing, especially with our immunizations clinic. So just trying to continue keeping that up.
So I have one announcement for you then, right? On April 19th, Baltimore City Health Department and Johns Hopkins is holding a symposium on the social determinants of health. There's going to be a great panel talking about healthy housing happening. I can't make it, but I've suggested that Wes or Michael from our team would be great to join Camille and Margaret Schnitzer on that. And hopefully we'll also discuss asthma, as we have an upcoming asthma summit on May 7th that we hope the city will be supporting. And I'll take from there, Julie. And again, anything you need and support from this group of characters, please call on all of us, right? And thank you for the work that you're doing and the city housing department is doing. But on May 7th, there will be an asthma summit. The annual asthma summit is happening at Bowie State University, if I am correct about that. But Cliff or George Stewart, do you want to say a few words about that?
You are correct about that. It will be a day-long summit, and we are holding it at Bowie State in part because we are trying to expand the reach and breadth of the summit to include the National Capital Region and Southern Maryland as well. But the focus is very much on things that are happening now with asthma that still, like lead, focus on environmental interventions that can improve asthma outcomes, just as we try to do with lead.
Well, Cliff, I don't know if we've talked about it, but I would really encourage you all to invite, I think it's Dr. Gray, the new head of WellPoint, who is such an amazing advocate around SDOH, asthma, and he is a really great speaker. And I don't know if I've had time to say this to Wes and our planning team on that. But if we're looking for some people to really dynamically do that, we will share with everybody all of the information for the summit and through our social media. So stay tuned on that. And the interplay of this is really important. The team at DHMH has been super incredible. And I want to thank our team too for stepping up. Is Chevelle Bash has moved over to Baltimore Connect, and we are so happy and pleased for her to get that opportunity to run their grants program. And only to say we are looking for the next generation leader to follow behind Chevelle on outreach and education, and to join the team with Alexia Jones and Abby Cock in doing this great work. So if you know somebody really good, I think if the job is paying relatively well, and you get to work with really, I think, great people and great agencies. And just because I believe in networks, I also will tell you that we are posting tomorrow for the head of the $50 million philanthropic effort. Then it will be the job of the leader of that program to give out $40 million over about 2.5 years, maybe a little bit less than that, to communities out throughout Region 3. And we want to have somebody who has a good sense of community-based organizations and work, the environment, environmental justice, excellent project management. And if they have a philanthropic background, that'll be a plus, but not a sole point to this. So keep a lookout on that. And if anybody's interested in joining the growing team at GHHI, we'd love to have you. Are there other comments as we bring this to an early close? Going once. Anything from the public? Going twice. Do we have anything in the chat, Wendy?
No, there's nothing in the chat.
Alrighty, we are giving you back an hour of your life. We will see you in May. I expect you to come with lots of good information. Wendy will send out assignments, I'm sure. Keep up the good work and really important prayers for the people on the recovery of the bridge. Thank you for all that are working on that and for the families that got impacted. For those who keep an eye on the Enough Act to see if that gets passed by the legislature, that'll be an additional opportunity for funding for lead. And we're all going to get behind Theo to get lots of money over to DHCD. All right. Take care. All right.